have Dr. Karam and patient Lisa Elliott here to discuss vaginal health issues and a new game-changing treatment option.
This is the MonaLisa Touch treatment, and I truly would categorize this as a game-changing treatment for a very common condition that we call in medical circles vaginal atrophy. Atrophy is basically a problem that occurs when a woman loses her circulating estrogen. The most common reason for that would be when a woman passes through menopause, her ovaries stop working, her estrogen levels drop, and in a matter of 1 to 3 or 4 years, the vagina basically dries up, and they start to complain of symptoms of dryness and irritation, and most importantly, pain with intercourse. Also, a variety of lower urinary tract symptoms can commonly accompany this problem. So the MonaLisa Touch is a minimally invasive, revolutionary laser treatment that is delivered in an office setting in a matter of minutes that really addresses these symptoms quite well. This problem impacts millions of postmenopausal women, and also, unfortunately, most breast cancer survivors have this problem because either they can't take estrogen because their tumor is estrogen dependent, or they're placed on a medicine that antagonizes the estrogen in their body, or they're simply fearful of estrogen because of all the unknowns and how it impacts breast cancer. I was fortunate enough to be the first clinician to utilize this treatment in the United States, and we conducted a research trial, and one of the first participants in that research trial was Lisa, who's with me today, and she's a breast cancer survivor, and she went through the treatment because she had a severe form of vaginal atrophy, and she can talk a little bit about the experience she's had with the MonaLisa Touch.
Great. Lisa, tell us about your experience and how it's helped you.
Well, when I was 29, I was diagnosed with breast cancer. Since that time, I've been on tamoxifen, which has since caused postmenopause-like symptoms, including vaginal atrophy. And with that, my sex life ended. There was no way that I could have sex at all. It was excruciatingly painful. And when you're 30 years old, that seems really daunting to live the rest of your life that way. I'm a little bit stubborn though, so I wasn't going to accept no for an answer, or there's no treatment for an answer. And I'm very fortunate to have come across the MonaLisa Touch and been able to be a part of Dr. Karam's clinical trials. It has had such success for me. I started noticing a change within 2 days of my first treatment. And since that time, it has just gotten progressively better. I am over the moon excited with how well this has worked. And I don't have to worry about the safety of it. I don't have to worry because there's no hormones. And as Dr. Karam alluded to again earlier, that, you know, I'm one of those people that can't have hormones. So this has been really important for me and for my life, not only my physical well-being, but my emotional well-being. And I know it is for many other women out there.
And what would you say to those other women out there who might not know to speak up or know that there's options out there having problems like this?
Well, first of all, I would say that you are not alone. You are in a club of millions of other women, and most of those women are silent about it. They feel that this is just part of the natural process and they just have to live with this, and that is not true. You have to be your own advocate. You have to really, look for the treatment options and find a doctor who is willing to work with you.
This is a problem that impacts so many women, but there's so much misperception about it. Women, unfortunately, have very little knowledge and education about this, and they just assume that it's the normal part of aging and that these are just symptoms that they have to live with. And they assume that the only therapy out there is hormones, and either they don't want to take them or they've tried them and they don't work. First thing is it's really important to get this problem out of the closet and let women like Lisa who have cancer, or like patients who just go through menopause, stop suffering in silence and start to hopefully gain back some of their quality of life. There's about 50 or 55 sites in the United States now offering this treatment. You go to smilemonalisa.com. Those various sites are listed.